Hello and welcome. I'm Adele Gauthier from Breast Cancer Foundation, and tonight we're talking about managing chemo and radiation side effects. Before we get started, some housekeeping. Just activate that slide. Okay, I encourage you to make the most of the chat box during this webinar. At the bottom of your screen, you'll see a taskbar or a status bar. If you can't see it, you might have to move your cursor down to bring up the chat box. Click on the chat icon and open the chat box, and then if you have any technical issues, you can type your problem there and our support team will be in touch. You can also use the chat box during the webinar to ask us questions, which we'll get to later, and you can chat to other people there as well. Don't worry about missing out on information while you're chatting. The webinar will be online tomorrow and you'll be able to catch the rest of it then. You should be able to see the panellists in a small box on your screen at the moment. There are some size bars just above that, so you can choose to make that box bigger or smaller. So tonight we're talking specifically about chemo and radiation, which can do great things in dealing with your breast cancer, but can have a whole range of side effects for some people that make life pretty tough. We've got three panellists who are going to share with us tonight. Patient, Kylie, our nurse, Catriona Farac, and Dr. Maria Pearse. First, we're going to hear from Kylie. She was diagnosed with breast cancer at the start of the year, and as far as treatments go, you name it, Kylie had it. Kylie, thanks so much for being here tonight and for being willing to share what you've learned along the way. Tell us about your experience of chemo and radiation and what got you through.
Okay. Hi everybody. I was diagnosed at the beginning of the year. I had my mammogram through Breast Screen Aotearoa, and they called me back and I had a repeat mammogram, ultrasound biopsy, and was diagnosed 2 weeks later. I then had some surgery in February where I had a partial mastectomy and my lymph nodes, 2 of those were removed. It was grade 2, stage 2 infiltrating ductal carcinoma. And then I started my treatment, should I say, in March. I had chemotherapy, where I had 2 lots of chemotherapy for 21 days, 3 cycles each, and I needed a portacath to be inserted, which actually was fantastic and allowed me to have access without having to be jabbed each time. I called it PayWave because basically it's like a tap and go. I then went on to radiation and I had 19 sessions of that. 15 were standard sessions, I guess, and 4 boosters. I did work all the way through my treatment, although I had to adjust some of the working times and availability, etc. But my workplace were really supportive, which was fantastic. In regards to side effects, there was a number of them. I'll talk about the ones that were probably the most difficult for me. The nausea was particularly bad. They did say to me at the beginning, do I get motion sickness, seasickness, and did I have morning sickness? And I did have all 3 of those. And they said, it's going to be terrible, and they weren't lying. I took a number of medications to help with that though, and did manage to get through relatively well. It was a little bit like being pregnant again though. I had ginger nuts and dry crackers to sort of help along the way as well. Another big one was the mucositis, which was really painful in my mouth, but actually it started at my mouth and went all the way through my whole system. I had a lot of fluid to help with that. Ice blocks were fantastic. They seemed to help just to ease some of the discomfort and being nice and cold. I also followed advice around salty gargles, and they helped quite a lot too. The mucositis obviously caused a lot of diarrhea. Let's just say you really need to be near a toilet, and I ensured that anywhere I was, the toilet was very handy. It was probably my first question that I ever left the house. And then just, be kind to yourself and have nice, comfortable toilet tissue, wet wipes, etc. My nails, they actually got quite weak and sort of almost separated, so to speak, and I just used to put nail polish on, kept them really short, used some hand cream and things, pampered yourself a little bit really, and that seemed to help quite a bit. The hair loss was expected. I knew that it was going to happen. When it started to come out after my first cycle, I cut it really short, and then in a real funky style, which was kind of cool. And then when it started falling out more, I shaved it, and then I just continue to wear headscarves and beanies, etc. I did have a wig as well, which was actually a few wigs, which were quite fun. Radiation side effect side of things, the main thing was really just to keep really hydrated and be really careful what you put on your skin. The warm water versus hot water. I used to like having a nice long soak in the bath, but I didn't do that during that time. They did put a Mepital dressing on my breast to try and help save the burns, but I actually had a lot of heat from the radiation, so it tended to just slip off. So I didn't bother in the end. I just used the non-ionic creams that they gave me. And once that all finished, I used some homeopathic cream just to help with some of the burns that I received. While I had that burn, particularly up here near my collarbone, I had a seatbelt cover to try and help sort of stop pressure. I rested when I needed to. Tried to do something physical, because by that stage I could actually go out and go for a walk, not worrying that I would have an accident, particularly around the diarrhea aspect. And that actually helped as well. For me, a really big thing was being alone when I felt really terrible. It was easier than having to think about anybody else. I've got 2 young children, and that made things quite difficult because I had to focus on them. So I just was basically alone when I felt really terrible. Naps are really important because then you get some energy back. And another big thing for me, where I'm pretty much an independent person, was to actually accept help when people offered. And I totally think that if somebody says they'll cook you a meal and put it in your freezer, say yes please, because it was fantastic. Yeah. For those of you who are supporting people going through all this, that encouragement and that praise and that when things are going well is really invaluable, because you feel kind of low, and having that positivity is fantastic. Letting you know that it's going to be one day at a time. You can't really plan certain things, you just have to roll with it. The small victories, if I win by one day, one more thing of chemo's done, it's like, yay, high five. Laughter. We did a lot of laughing, probably in some ways about things that were probably inappropriate, but that really helped me. And I guess for people supporting as well, for them not to worry quite so much, because you're just having to go through the motions. That some of the medication can make you quite moody, and one I was quite irritable with. And I guess for people to realise that it wasn't me, it was actually the influence of the medication. And I guess knowing that they too need help, and if they need help, to ask for help as well. So now I'm at the end. I've gone through this year, and I finished in September. I've now got what is my new normal, I guess. I want to look at how things are quite different compared to where they were before. I joined the Pink Dragons. If anyone there would like to join the Pink Dragons, I'll put a little push there. It's fantastic. It's really motivating, and I feel quite physically empowered. And it's using my body in a much more positive way that I probably took for granted, to be honest. My nails are still somewhat weak and brittle, but they're getting stronger, which is good. My hair is actually starting to grow back, which is fabulous. And it's summer, I don't have to wear a beanie anymore, which is really good. I guess, it is summer and I've had radiation, so I have to be really careful in the sun and not to get burnt. And New Zealand, it's slip, slop, slap anyway, but I guess that's probably even more important now. And I think the big thing is the fact that, it sounds sort of cliche or whatever, but I feel reborn. I feel like I don't want to take this life and this body for granted, and I want to just go forward and use it in a really positive way and make the best of what life is and has to offer. It's all pretty exciting in some ways, but also having gone through this journey, I've realised that I can help other women as well, and I can talk to them and support them through it. So, yeah.
That's fantastic. Thank you so much, Kylie. I think that will have been really helpful for everybody out there. And it's great to have you here looking really so well.
Yeah.
And,
Thank you.
Yeah.
Thank you.
So now we're going to hear from Breast Cancer Foundation nurse Catriona Farac. Catriona's worked at Auckland City Hospital as an oncology nurse, and now we're lucky enough to have her here with us at Breast Cancer Foundation. If you ever emailed our nurses or phoned our helpline, you may have spoken to Catriona before. Catriona, you've helped many women go through their breast cancer chemo, and you've helped to make treatments like chemo go smoothly and help people to deal with the symptoms. What are the side effects you come across, and what tips do you have for managing them?
Right, well, I've got lots of tips for managing them, that's for sure. Lots of anecdotal evidence and lots of proven research-based remedies. My name is Catriona. I'm one of the nurses at the Breast Cancer Foundation. I've worked in cancer care for nearly 20 years now, spanning across 3 different countries, and to be very honest, the experience is exactly the same, irrelevant of where you are. Chemotherapy has been used as a mainstay of cancer treatment for decades, basically since the 1940s. It can be used after surgery, which is called adjuvant treatment, and that is used to kill any cancer cells that may be left behind after the surgery, and to reduce the risk of the cancer returning. It can be used before surgery, which is known as neoadjuvant, and that's used to shrink the tumour so that less tissue needs to be removed, so the surgery can be smaller. It is a systemic treatment, and that basically means that it treats cancer anywhere in the body, so it circulates around your bloodstream. Because it affects your whole body, unfortunately, then there are side effects as well that can be problematic. It does kill healthy cells along the way, and that's what causes the side effects. The immediate side effects before we do that, just important advice, look, don't compare yourself to anybody else. The disease may be the same, the chemotherapy drugs may be the same, but you are the one that is different. You are unique, and your experience may not be the same as anybody else. So it is good to get advice, it is good to get tips, but remember, this is your journey, nobody else's. Immediate side effects on the chemo, so what you might experience while the chemo is going in or on the day of the chemotherapy. Certain drugs will make your urine a red or an orange colour. That is normal, that will last for the first day or so. It is really important on the day of your chemo just to drink plenty of fluids. This will help to flush your system and help any urine to flush out of your bladder quite quickly. You may notice that you have a blocked nose or a strange taste in your mouth. This may be a side effect of one of the chemotherapy drugs you're having. It will not harm you, but if you do notice it's happening, just let your chemotherapy nurse know, and they will slow the infusion down a little bit. The resident side effects really generally tend to happen within the first week or so after your chemotherapy. The one that us nurses and the oncology team worry about most is bone marrow suppression, which is a low blood count. Now, this is something that we monitor. We, as chemotherapy nurses, will give you some blood forms, and from those blood tests that you have taken, we will monitor them. So it is really not something you can control, and it's something that we will take control of for you. When your white blood cell count is low in your system, this is known as neutropenia, and it's a term that you'll hear used very, very often. If you're neutropenic, it means your ability to fight infection can be reduced. It generally will happen, if it does, between 7 and 10 days after your chemotherapy. Like I said, we will monitor that neutrophil count, and we will make sure that they have improved to normal again before the next cycle of chemotherapy is given. A lot of women actually will have neutropenia. The counts will drop down, they will feel perfectly fine and well, and then the counts will come back up again, and bar the evidence on the blood test, they will feel absolutely fine. However, it is really very important that if you have a high temperature or you feel unwell while you're having your chemotherapy, that you report that straight away, because it may be a sign that you have an infection. If that's the case, your team will bring you into hospital, they will assess you, and they will give you antibiotics to support your system through it. But it is super important that you actually do let your oncology team know. Low platelets, so this is got a long term on it called thrombocytopenia. And it basically means that your clotting is a little bit abnormal. So you just basically watch out for signs of bleeding and bruising easily. So things like your gums will bleed more than normal, or if you bang your leg, you might get a bigger bruise than you normally would. There's not a lot that we do for that except monitor it unless your counts are drastically low. But again, the regular blood test that you will have will monitor that for you. But do report any unusual heavy nosebleeds or any new rash that may develop on your skin. Nausea and vomiting. I think nausea and vomiting is probably the one side effect that most people are aware of. Prevention is better than cure. Prevention is easier than cure. What we want to do is give you a whole host of medications to take before your chemotherapy and after your chemotherapy to prevent you being nauseated. By doing this, the aim is that you can eat and drink normally and keep as well as possible during your chemotherapy treatment. This then will help you to get through that treatment feeling as healthy as you possibly can be. There is what's known as immediate nausea and vomiting, which happens during the time of your chemo or just straight afterwards, and then delayed nausea and vomiting. There is a trial called the Pantasem trial for prevention of delayed nausea, and that's available in 10 hospitals around New Zealand. So do please ask your oncology team about that. Please take your anti-nausea medication as prescribed. Report any unresolved medications. So as I said before, you're an individual. Medications can be swapped because one size doesn't fit all, and we can find the right regime for you. Helpful tips: eat small, frequent meals as they can be easier to digest. Eat and drink slowly and chew your food well. Avoid certain foods such as overly sweet, fried, fatty, or strong smelling or spicy foods. Some people find ginger or peppermint might help. And avoid coffee and avoid lots of alcohol, which you should do anyway during your chemo. Some people find also that travel sickness bands are helpful. Hair loss, as Kylie discussed, you might find that you lose your hair from all of your body or just from your head. Things that you should consider: discuss with your team about a wig or headwear subsidy form from the Ministry of Health. Some people actually find it's useful while they're waiting for their chemo to start to be proactive and to go out and get that wig sourced. Cut your hair short or shave it before it falls out. Protect your scalp from heat, sun and cold. Your scalp has not been exposed to the sun since you were a baby, so that's a long time for some people, so it is quite sensitive to the sun. Use gentle hair care, including mild shampoos and hairbrushes. And also ask your oncology team about some Bimatoprost gel or eye drops that can prevent eyelash loss. Also check out Look Good Feel Better. They're a really great organisation. Scalp cooling is something that some women investigate. Scalp cooling with cold caps can be an option for reducing hair loss during your chemo. It's available currently in Nelson and Rotorua in public following a Breast Cancer Foundation trial and rollout. And it is available in some private clinics as well. Other options include penguin caps or ice caps. Mouth cares, as Kylie mentioned, she had mucositis. Basically, this is where the cells in the lining of your mouth replace themselves every couple of days. This is really good, as most of us will know when we burn our mouth with a hot coffee, that it just takes a day or two for that to get better. But unfortunately, because those cells divide quite rapidly, it does make them a prime target for damage by chemotherapy. Things you can do: use salt and baking soda mouthwash regularly, avoid smoking, spicy foods, very hot foods, hard or crunchy foods, and ideally see a dentist before you start chemotherapy if you can. And they just basically will take care of any dental work that may need doing. If you're a member of My BC, we have got lots of tips on mouth care and actually lots of tips on lots of the other side effects as well. Nail changes: most nail changes from chemotherapy are cosmetic and will grow out at the end of the treatment. However, do be aware of any signs of infection in the nail bed and do report these. Again, there's lots of tips and tricks for nail care during chemotherapy on My BC. If you're not a member of My BC or you want to know more about it, just please give our nurses a call or send us an email tomorrow and we will help you get on that track. Consider using polybalm ointment as well to prevent some nail damage. Skin care and sun sense: some people notice their skin may be more sensitive than normal to the normal skincare products, and you may need to look for some more products for sensitive skin. Chemotherapy makes your skin a lot more sensitive to the sun, irrelevant of your skin type, and that sensitivity does last for a whole year after your chemotherapy is finished. Cover up, stay in the shade, and remember to wear a hat. There are lots of other side effects that we haven't mentioned tonight just because of time constraints, including diarrhea, fatigue, chemo brain, which basically affects your concentration, your memory, taste and smell changes, swollen ankles, feet, sore hands and feet, peripheral neuropathy, and of course the one I haven't mentioned on there is the emotional effects of having chemotherapy, and that is not to be underestimated. So please take time to take care of yourself, seek advice, seek support, seek care, give us a call, and we will help you organise some support.
Great. I'm going the wrong way there. Okay, thank you so much, Catriona. That was really helpful. And I think for those of you at home, if you want to know more about any of those specific side effects or you have any questions, don't forget to use the chat box to ask your questions now, and we'll get to those at the end. You can load those up at any time. Our last speaker tonight is Dr. Maria Pearse. She's a radiation oncologist at Auckland Hospital and in private practice, specialising in breast cancer. Maria, who gets radiation and why, and what are the side effects people can expect?
Yeah, so welcome everybody. It's good of you to make the time at such a busy time of year. What I'm going to do is talk about the management of the side effects of radiation following surgery for breast cancer. So in the interest of time, I'm actually going to just concentrate on the side effects that happen during the treatment and a few months afterwards. So what is radiation therapy? So what it is the use of high energy X-rays to treat breast cancer. So radiation is given to kill cancer cells in the area that the radiation is directed at. The radiation can affect the normal healthy cells in the area treated, but these cells can actually repair themselves because they're not dividing as quickly as cancer cells. So there's many different types of radiation therapy, and this is a picture of one of the radiation therapy machines used to treat breast cancer. So it's like a big X-ray machine. And with this type of radiation therapy, it doesn't make you radioactive, so you can be around family and friends. The only time you're receiving the treatment is when you're lying on the bed and the machine's turned on. After that, you're fine to be around people. So who has radiation therapy? So there's a number of different types of patients that will be offered radiation therapy. So for those patients who have just had the tumour removed from the breast, so they still have the breast and have just had the lump removed, or what we call a partial mastectomy, most of those patients will be offered radiation therapy because despite having the cancer removed, there is a risk something may come back in the breast, and so we give radiation to mop up any cancer cells left behind. If you've had a mastectomy, which is when the breast has been removed, then there are particular situations where we would recommend radiation because we know despite having the mastectomy, you may have something come back in the breast. So if you have cancer that's travelled into the lymph nodes in the armpit, then we usually recommend radiation. If the breast cancer is over 5 centimetres in size, or if there's involvement of the skin or the chest wall. So those are the situations when, if someone's had a mastectomy, we would normally offer radiation therapy. So the side effects of radiation therapy, I think the really important thing to remember is, and as Kylie alluded to, everyone is different, and people get the same treatment and they react differently. With the radiation, the side effects that people get and that I'm going to talk about are usually temporary, and they usually are present during the treatment and for a few weeks to months afterwards. The radiation side effects are limited to where we're treating. So the X-rays are directed at one particular place, such as the breast, and so the side effects are limited to the tissues in that area. One of the really important things to appreciate is that with the radiation treatment, usually the side effects will peak the 2 to 3 weeks after you finish. So it's really tricky because especially if you've been through surgery, you finish your course of radiation, the actual side effects will be at their worst those 2 to 3 weeks after you finish. So it's important to get that and have that mindset that you're actually going to be having side effects after you've finished and for a few months afterwards until they settle down. For the majority of patients, the side effects are pretty minimal at the beginning. They tend to come on through the treatment and peak the 2 to 3 weeks after and then settle down. So I tried to Google breast cancer radiation skin side effects, and all I could find was very nasty side effects, which I do not tend to see on a day-to-day basis. So these are actually pictures of sunburn, and the top picture is kind of what we often see with patients towards the end of treatment, the week or two following. So the skin usually becomes red. It can be a bit tender, it can look and feel a bit like a sunburn, so it can feel a bit swollen, a bit itchy. And the photo of the sunburn down below is less likely, but sometimes people do get quite a brisk skin reaction and occasionally a bit of peeling of the skin. So there is a huge range. We get some people who just get a little bit of pinking and that's all they get, and the other extreme is bright red with a bit of peeling. If it does peel, it's usually temporary, a week or two, it looks a bit mucky, we put some dressings on and it heals up very, very quickly. If the skin's itchy, we can put something on that as well. The nipple, because all the nerve endings go there, it can be a little bit tender. Some people take a bit of Panadol. Most people don't need anything, and we often use a little pad on the nipple if need be, just because it can get a little bit crusty. And a lot of departments offer Mepitel film, which is a film that goes on the skin. It basically prevents any sort of frictional rubbing on the skin, and it usually works very well for the skin reaction. It's waterproof, it just stays on your skin, you can shower in it, it doesn't need to come off for treatment. And it tends to work very well, but in the hotter months often it does peel off because people are hot, and often once it's kind of peeled off we just use our standard creams. Some departments don't offer this, and there's a number of creams that your nurse and radiation oncology staff can offer. What you can do to help, so just treat it like a sunburn, wear loose clothing, comfortable clothing. Underwire bras tend to dig in, so we try and get you to avoid those. If you can shower, if you are showering, just use lukewarm water and make sure you just pat dry afterwards. And as mentioned, you know, your team will advise you on the creams that you can use. Avoid chlorinated pools, spa pools. The chemicals can interact with the skin. Avoid rubbing on the area that we're treating. Avoid sunlight, and prefer not to shave or wax in the area that we're treating. Things with extremes in temperature like hot water bottles, ice packs, those sort of things, if you can just avoid those. And these are all alluding to the area that we're treating. And just keep away from things like perfume, massage oils, just while you're on treatment until the side effects have settled. Fatigue is really common. It tends to be, it tends to kind of come on midway through, but tends to peak end of treatment and week or two following. And often it can take some months before your energy levels are back to normal. And most people I see about 6 weeks after treatment, they feel about 67% back to normal. So they're feeling better, but they're not quite back to normal. Best things you can do are actually rest. We tend to find people who overdo it, get more tired, it takes longer to get better. Just have a healthy, balanced diet. As Kylie alluded to, accept help. You know, people feel they need to do something, they want to help, and it's hard for us to accept help. But I think it's, you know, if you can accept help, it will make things easier for you. You need to advise your team on what supplements you're taking. There are some supplements that we prefer you not to take during radiation just because it might make the radiation less effective. And if you do exercise, we tend to find people who exercise tend not to get as tired as people who do no exercise. And we've got a webinar on fatigue as well, so you can check that out.
Great, thank you so much. I'll just zoom us out there. Okay. Right, thank you so much to all three of you. That's been excellent. And we're now going to open up to questions from you guys at home. We have quite a few here, but please feel free to ask some more and we'll just work our way through them. I'll just direct those out to our speakers. Okay, so first up a question, Catriona. After chemo and while I'm taking my anti-nausea drugs, I feel very jittery and can't sleep. How can I minimise this?
I think it depends on what the anti-nausea drugs are, because different anti-nausea drugs do have different side effects. One of the common anti-nausea drugs that are used is a steroid, and some people find that's a very harsh medication to take. So it is definitely worth speaking to the breast care nurse if it's quite severe. But if it can wait until the next time you go back and see the medical oncologist for your next chemo assessment, definitely mention it to them and they can change the anti-nausea medications around so that can be prevented.
Right, so there might be some non-steroid ones.
Absolutely, there are always other options available.
Excellent, great. Okay. Now a question, Maria, can you explain about boost treatments and radiation therapy?
Yeah, sure. So for some people, and in Kylie's case, if people are triple negative, then often we do a boost treatment. So we treat the whole breast for the standard 3 weeks, and then we do an extra week to where the tumour was as a boost to reduce the risk of something coming back, because in that situation, sometimes they are at slightly higher risk at the area where the tumour was of something coming back. So if we give an extra week of treatment, that will reduce that risk down. So there's particular situations where we would recommend having a boost treatment. This is only for people who have had the lump out and have an intact breast, because those are the people that benefit from having a boost. So if you've had a mastectomy, there's no benefit to having a boost.
Great, okay. Now a question, I've had severe gut issues during chemo. What is a good gut repair plan? That's from Kim.
I think it really does depend on what the gut issues are. If it's lower down your gut, so if it's issues with diarrhea, constipation or bloating, and that either of those three can be quite common during chemotherapy, then I think it is definitely worth actually, again, referring back to the breast care nurse or the oncologist, because they can look at any other medication you're taking or any other medical problems that you may be having, and then they can actually come up with an individual plan for what would work best, because there are treatments for all of them. If the gut issue is in the top, where it's reflux or indigestion or heartburn, then there are some medications that you can take, such as antacids, to try and prevent those side effects. Now, some people will take the antacid only during the time of their chemotherapy and then stop and have a break in between the cycles. But you can actually take it the whole way through, because it does take up to 7 days to reach effectiveness in your system. So it may be worth actually staying on that antacid the entire time of your chemo, and that is completely harmless to do that.
Right, great. That's very helpful. Thank you. Now, one for radiation here, Maria. I have a rare autoimmune disease called relapsing polychondritis that affects the cartilage in my body. I get costochondritis in my ribs. On the side, I've had surgery. Will radiation treatment affect my ribs or cartilage and this condition in general? And this person's also had pneumonia and worried about her lungs. So,
what is the condition?
relapsing polychondritis.
No.
We might have to come back to you on that.
Yes, sorry about that.
We'll drop you an email on that.
Yeah, there are particular situations where we wouldn't recommend having radiation if people have got an underlying medical condition, but that is not one I'm familiar with. But it's probably a pretty rare condition. So we can have a look at that and get back to you.
And actually, Kylie, on the subject of radiation, how did you find you got fatigued with it?
I was probably lucky, I guess, in that I didn't really. I think the first couple of weeks afterwards I felt ever so slightly more tired, but not enough to stop me. I was back working full time. I was going walking at least 3 times a week, which I think, like you were saying, actually helped a lot. So no, I didn't really get the fatigue so much, which was, I felt more fatigued, if anything, when I was going through chemo, but I think that was from all the side effects that were going on, that I was quite weak with not really eating very much and having a lot of diarrhea.
Right.
Yeah. So no, fatigue for me wasn't an issue.
Great. Okay, another chemo question. I think we can have a few of those. I've just started docetaxel and Herceptin after having 3 rounds of FEC. My heart rate has increased 4 days after chemo, going up to 150 BPM. Is this a normal side effect from chemo?
No, it's not. It's not, and it's definitely something that I would report to your medical oncologist. If your heart rate goes up that high, and if it's during working hours, I would ring either the emergency department or the acute oncology department at your local hospital. If it's outside of ours and you're feeling unwell, I would actually present to your local ED.
Great. Okay, very helpful advice. Thank you very much for that. Right, radiation. Do you still get sunburn if you don't normally burn from the sun?
You can do, yeah, and it's a good question actually. So some people with very, very fair skin are really worried they're going to get a lot worse reaction, but some of those people actually don't, so it isn't really skin dependent. Some do get a worse reaction, but some just get the same as everyone else. So yeah,
that's interesting. Yeah. What was the name of the eyelash?
Bimatoprost.
Bimatoprost. And how efficient is it? Is the other question on the same subject?
Again, the evidence on it is anecdotal. There haven't really been research trials on it. Some people find it very, very effective if it's used properly. But obviously it needs to be used right at the start of the treatment, because once the eyelashes start falling out, then it's hard to keep them intact. This is a preventative measure. It is a medication that's used to treat glaucoma, so it's something that if people wanted to Google or research, they can do it themselves.
So it's going to be a prescription medication?
Yes, definitely. Anything at all that you take during your cancer treatment, be it radiotherapy or chemotherapy, even if it's something that seems really benign, like a vitamin C supplement, it is always worth letting your team know, because sometimes they can interact with the medication you're taking. So yeah, let them know, and you can get a prescription from your oncologist.
Right, and if you were sort of about to see your oncologist, would your GP?
Absolutely, speak to your GP. Yeah.
Great, okay. Right, and a question about being on prednisone during radiation. Is that an issue?
No.
No? Oh.
We have lots of people on steroids.
Yeah, we like easy answers. Okay. And another question from Kim about oral candida, oral thrush, despite taking Milstat, which I guess is that's a medication to prevent thrush, I guess. Any suggestions? So yes, bad oral candida and esophageal candida and gastritis. Any suggestions for managing that? And
if it's a recurrent issue, then I would again refer back to the medical oncologist. But potentially the length of time she was on the antifungal medication may not have been long enough. There's also an issue of actually using the medication properly. So I think that often can be a big issue. If you're using Milstat, it is really important to use it 4 times a day. It is important not to eat or drink anything for a good 40 minutes after using the Milstat, because it just works in the area where it sits. So if you have a drink, you wash it away and it becomes completely ineffective. Also, if you have dentures, and Kim, I'm sorry, I don't know if you do or don't, but if you have dentures, it is a good idea to soak those dentures in Milstat, not in neat Milstat, but your normal denture solution, and just a couple of drops of Milstat as well at night, because otherwise you risk sort of reinfecting your mouth again if your dentures are still carrying that. That's still carrying the thrush.
Very good, thank you. Okay. I'm having dose-dense chemo, so 1 cycle every 2 weeks. Will the side effects compound, including neutropenia?
Sometimes they can do, but it generally is up to your oncologist. It's a very individual thing as to whether they feel that you would be capable of having dose-dense chemo in the first place anyway. But people that have dose-dense chemo 99% of the time will have pegfilgrastim. And pegfilgrastim is an injection you have in your tummy the day after you have your chemo, and that the intention of that is to stop the blood counts actually dropping in the first place. So it is almost an extra support system for that bone marrow.
Okay, great. Now, Kylie, a question about wigs.
Oh, yes.
Here's someone who's having her first chemo a week before Christmas. Should I get a wig before Christmas or not?
I think the shopping for wigs is really fun. So in the sense of that, it's kind of a good thing, and you can try it out before you need to use it, and you've got it available. I mean, my hair did fall out after the first cycle, so you're having something to cover your head however you wish to do so. The wigs for me, I got the subsidy, and I got a really good wig, and it looked very similar to my own hair, but I think I wore it maybe as many times as my fingers on my hand, because it didn't really feel comfortable for me. For me, it was more about beanies and scarves and things. I think also just the fact that it's summer and it's really hot, they are kind of scratchy. I think it's more what you want to wear, and if you think you'd like to have a wig and go and get one beforehand, then absolutely, yeah.
Can I put a point on that? Yeah. Some people actually find that getting a wig before they lose their hair, taking it to their hairdresser and getting their hairdresser to style it as similar to their hair as possible.
Yeah.
Really they can feel a lot more comforting, and then people just go wild and have something completely different. But that is just an option to consider.
Yeah, if you want to feel like you look like yourself.
Absolutely.
Yeah, I think for that reason too, it would actually be, before your hair's gone, you're getting used to having the wig and it's already available to you. Yeah.
Great. Okay. We've just got a few more questions left, but we do have some more time. So if you haven't asked your burning question yet, do go ahead, and we should have time for that. Okay, with radiation treatment, is it every day for the whole 3 weeks?
Yes, so the radiation's given Monday to Friday, so you have the weekends off, and for 3 weeks. Sometimes we do give 5 weeks, and sometimes we give 4 weeks, so it can vary, but majority of people would have 3 weeks.
And how long are you at the hospital for?
So normally you're there for around about half an hour from checking in to leaving. So you basically arrive, pop the gown on, get on the bed. Most of the time is getting you positioned in the right position, making sure everything's in the right place. The actual treatment only takes a couple of minutes, so it's very quick here. It's like having an x-ray, you don't feel anything.
Great, okay. Now a tip from one of our audience, thank you. Worth noting, you shouldn't be reluctant to take medication you might not normally take, such as strong painkillers or sleeping tablets. How do you feel about that?
I think absolutely. With regard to sleeping tablets, and actually we get quite a few questions about sleeping tablets, but some of the medications, like the steroids that you have with your chemotherapy, can keep you awake or can make you feel a little bit jittery. And actually what you want to do is keep as well as possible during your treatment. So by having a good night's sleep, it can make you feel 100% the following day and get up and be refreshed, rather than, than having sleepless nights unnecessarily. And absolutely, again, with the painkillers, keep taking the painkillers as long as you need them. Your GP, your medical oncologist, your surgeon, your radiation oncologist are monitoring what you take, so there's no chance of getting addicted or, taking too much of anything. It's all well and truly monitored and controlled. So,
I mean, I went from taking the odd Panadol to quite a collection of medication throughout that time, and it was kind of shocking initially, but thank goodness I took them, because I managed to get myself through and I felt really well because of that. And I would go back and sometimes have another one added because something wasn't quite right. I just say, listen to your health professionals.
Right, yeah, great. Now, a question about pink dragons. Can you tell us what that is?
So the Pink Dragons is a dragon boat team for breast cancer survivors, and it's absolutely and utterly fantastic. You meet women who are like-minded in the sense that they've gone through this ordeal, this journey, whatever you like to call it, but that's not actually your focus. You're there to be part of this team, to use your body in a really physical way, to get fit, to feel strong, to be empowered. And the fact that you're surrounded by women who have all fought this, this horrible thing, it's that in itself is really fantastic, because you've got that kindred spirit and understanding. But that's not actually what we focus on. It's not like we all get together and say, talk about breast cancer and show me your boobs or anything like that. It's more about actually just that that getting together and being, recovery and being strong. We go twice a week on a Tuesday and a Thursday night for training, and then there's a number of regattas. I've done one so far. They had another one that I unfortunately missed out on, but we race against other women who have breast cancer too. So it's that's our comrades for people we're going to try and beat, and we definitely want to beat them. It's really good. It's just fantastic.
Yeah. And I believe there's a documentary being made about dragon boating after breast cancer.
Yeah, there is.
Starring in?
Yes, yes, that's right. And that's quite exciting too, because that's a whole other level where people are wanting to hear our story, I guess, and see that where we started to where we'll hopefully get to, and it's really exciting.
Yeah, we do hear from a lot of women who find it very helpful and make great friends.
Yeah.
Okay, Catriona, a question for you. I've had a really bad reaction to the pegfilgrastim injection after my first chemo cycle. So they skipped this after the second cycle. Is there any other alternative to this?
There isn't really. There is a similar drug called GCSF, which can be given if your counts do drop down. So that's almost a rescue. That's the ambulance at the bottom of the cliff versus the pegfilgrastim, which is at the top of the cliff, right, as a prevention. It is unusual to have a reaction to the pegfilgrastim. And I haven't really heard of anyone having that reaction before, but your team will keep an eye on your blood counts. They'll keep an eye very closely on those blood counts. So rest assured that will be monitored, and if necessary, then perhaps trying some GCSF to help recover those blood counts if necessary.
Perhaps really bad luck for this question. Not something that hopefully too many people will experience. Right. Maria, does radiation increase the chance of having other types of cancer?
So with radiation, there is a risk you could get a cancer in the future from the radiation. The risk is less than 1 in 1,000, so it's pretty uncommon, but that is one small risk with the radiation. But it would have to be a cancer in the area the radiation had been given, so you can't consider a cancer, say a bowel cancer in the bowel, way away from where the radiation was given as a radiation-related cancer.
Right. Okay. Now we've had a question about hormone treatments which are given to patients with ER positive or PR positive breast cancer, but where that is kind of a whole new window on side effects, and we do have a separate webinar about that. So we won't talk about that tonight, but we'll suggest you go and watch that webinar. In fact, it's our most popular webinar ever, because
ring us tomorrow.
People or ring our nurses tomorrow, and we'll have the number available for you later. But yes, if you are on hormone therapy now, then yes, do call our nurses tomorrow, or if that's something you've got coming up, you might want to watch the webinar on side effects and get some ideas from that. Okay, is there a risk of lymphedema from radiation?
Depends where the radiation's been given. So if we give radiation to the breast, it's very unlikely to get lymphedema of the breast, although occasionally it can happen, and it can be managed very well with physiotherapy. If we give radiation to the axilla, the armpit, and you have had the lymph nodes removed from the armpit, there is a definite risk of lymphedema in the armpit. So it all depends on where the radiation is given.
And we do offer some...
so the Breast Cancer Foundation do offer some funding for lymphedema assessment and treatment to anyone that is at risk of developing lymphedema, or anyone who's got newly diagnosed lymphedema. We do have a criteria which you can see on our site, but you can also just give us a call or send us an email as well, and we can chat to you at any time.
Great, and again, we'll put those contact details up a bit later. Let's see what else we've got here. Oh, a question for Kylie. I'm not sure if, can I ask Kylie how she coped with having small children? I'm not sure how small your...
I've got teenagers now, so not necessarily that small. But I thank you that you think I've had small children.
But you still needed energy and ability to engage with them.
Yeah, I think the fact that they were teenagers was really helpful, in the sense that they could be somewhat more independent from me, and that I could say I want to be alone, and they would leave me to be alone, and they would make me cups of tea and help out. I think that I still had to, drop the youngest to school and then pick up sometimes, or take her to training and, for sports and things. And I think that's where your help comes in really handy. My ex-husband would come in and he helped out quite a lot extra than what he would have normally done when I needed it. Friends would do the same. My children's friends, their parents would help out. So I think it's just putting that network out there and being willing to say, actually, I'm not really able to do these things right now. And if people offer to actually say yes. So that for me was really how I handled that. Yeah.
And maybe having some specific thoughts when someone says, what can I do? Have a little list in your head that you can actually just tell them something. Yeah,
definitely. I was told that from one of my friends who worked in oncology, and she said, you need to give people something to do, because they don't know what to do. And unless you say, it would be great if you, meals for the freezer, and then suddenly it was like an abundance of food all coming to your house. But that was absolutely invaluable. Yeah.
And we hear of people having rosters for picking up their kids and that kind of thing, which is, again, super helpful.
Yeah, definitely.
Okay, let's see. Maria, can you talk a little bit about breath holding during radiation treatment? What is that? What does it do?
Yeah, so when we're treating the left breast, the heart sits behind the left breast, and so to reduce the radiation dose to the heart, we get people to practice the breath hold technique. So what happens is when you take a breath in, it moves the breast away from the heart. So if this is your heart and this is your breast, and you take the breath in, it will move the two away from each other. So what we do is get you to see if you can hold your breath for 20 seconds, and then when we come for your marking up for the radiation, we do 2 scans. One scan with you breathing normally, and then we do one with you holding your breath. And for some people, just because of their body shape, their heart looks fine when they're breathing normally, but for the majority of people, when they hold their breath, the heart is in a much better position, and we can pretty much avoid the heart with radiation. And so what we do when you're having treatment is we just do something like 6 to 8 20-second treatments. So we just get you to hold your breath, 20 seconds of treatment, have a rest, hold your breath, 20 seconds of treatment. We can also use blocks to block the heart as well. So we do have a lot of techniques these days to reduce the heart dose.
And a couple of hospitals also have a sort of a machine-assisted breath hold.
So
in Christchurch and maybe in Tauranga and
Yes,
Kathleen Kilgore's
yeah.
centre, I think.
Yeah, and I think ARO has that as
and
well.
some
so,
private
yeah,
centres.
Yeah, yeah. So not every department offers it, but most people do. Yeah.
Great. Okay. Right, we're nearly done here. Just a question about, can you tell, as a nurse, can you tell who's going to have lots of symptoms and who's not before they start?
Not really. I think there is probably one, and Kylie's already identified that. With regards nausea and vomiting, being female, which unfortunately the majority of people with breast cancer are female, being female, being younger, having morning travel sickness, morning sickness and pregnancy, it's almost like a little tick the box, and you can identify those people that actually are more likely to suffer from nausea and vomiting. But again, in saying that, it just means there are lots more treatments we can offer. We're more aware of it, so we're more proactive with it. Certain chemotherapies will definitely cause you to lose your hair. Some will cause just hair thinning. So those kind of side effects we absolutely can tell from the treatment itself. But bar the nausea and vomiting, not really, unfortunately.
So just because you're more likely to get that doesn't mean you're more likely to get
and I suppose people, that have got things like irritable bowel, or people that have got, that are predisposed to heartburn or indigestion, we possibly would be a little bit more wary and a bit more careful and assess them a bit more carefully for side effects. But yeah.
Can I keep using regular mouth ulcer medications like Kenalog?
But the best treatment for prevention and also treatment of mouth ulcers is a salt and sodium bicarbonate mouthwash. It is cheap, it is easy to make up at home. Use it the entire way through your treatment. Use it twice a day, 4 times a day if you're sitting at home, but definitely twice a day. And it is basically, get a big jam jar, mix equal quantities of salt and baking soda in that jam jar, mix it well, and then twice a day put roughly 1/4 to 1/2 teaspoon of that in a cup of warm water and stir it to dissolve. The reason you want warm water is so the salt and baking soda will dissolve in it and not just sit at the bottom of the glass. And then just rinse your mouth regularly with that. It is a really good antiseptic without having the astringent effect of the alcohol that most mouthwashes use. If you're finding you do have mucositis, definitely get it assessed regularly and speak to your team, because there are lots of other options available on prescription as well.
And I think you said the mouthwashes.
The mouthwashes were fantastic. We did them probably at least 4 times a day. And
I think the other thing with mouth care is use a soft toothbrush. And also, if you don't floss your teeth regularly, don't start while you're on chemotherapy. Because it does irritate your gums a lot more.
Okay, that's very good. Okay. Right, I think we are all done there. So can I have that slide gizmo? We've already done it. Thank you, Julia. Okay, so this webinar may have raised some questions for you, or you might feel that we didn't quite answer your question, and certainly one of you, we're going to come back on the polychondritis anyway tomorrow or the next day. But yes, if you do have any questions, call our nurses during office hours, and the number is on your screen there. We also have an online community, MyBC. It's a way to connect with other people who have the same kind of breast cancer that you do, who are at the same stage as you, who may be in your own local area. There's lots of different ways to connect with people there, and our nurses are on that community too, keeping an eye on the conversation. So join us at mybc.care, or you can download the app from the Apple Store or the Android store. We do have one more question there that's coming there. Oh, no, just a big thank you. And it's a big thank you from us to here, all of you, Kylie, Catriona and Maria. You've been fantastic tonight, and we really appreciate your time. As you're leaving the webinar from home there, we'd really appreciate it if you could take a minute to give your feedback on the survey link that will pop up. And as I said, the webinar will be online in the next day or two, and we'll send you out a link to that. We can also provide referrals to our free counselling and the lymphedema that Catriona mentioned before, and physiotherapy sessions. So we'll provide that information in the email that you're going to receive, but again, call or email our nurses sooner if you want to contact them straight away. Thank you very much for joining us, and good night.